Well, hello, everybody, and welcome. Welcome to Live with Leslie. I'm Lesli Bitel, and I'm so happy that you're here with us today. Give us a comment. Let us know where you're from in the comment section, and would love to hear where you're from and your area of expertise. So now for today's live stream, if you find yourself curious about holistic treatment strategies, specifically for kiddos, kids and teens, around treating ADHD, anxiety, and depression. And specifically, we're talking holistic treatment options without resorting to meds as first line therapy, then you are in the right place because today I'm so excited. I have a great show lined up for you today. We're going to be talking to Dr. Ellie MacGregor from Middle Path Integrative Pediatrics. And today's topic is reimagining pediatric brain health, a holistic approach. So welcome, Ellie.
Hi, thanks for having me. I'm really excited to be here.
Really looking forward to this conversation. And my guess is that it is a topic that is very near and dear to certainly my heart, and I'm going to guess our audience as well, right? Especially if anyone has ever been in that situation, or if you have patients, younger patients who are kind of struggling with some of these issues, anxiety, ADHD, depression. It can be a real challenge. So tell us a little bit before we jump into the topic. How did you end up? Tell us a little bit about your background. I didn't read your bio. I think sometimes it's more fun if we can hear it directly from you. So share a little bit about your background and how you ended up in private practice doing this work.
Sure, 100%. So I am an osteopath, so I'm a doctor of osteopathy. And so I'm classically trained in medicine. And I attended Nicklaus Children's Hospital for my residency in Miami, Florida. From there, I started practicing actually out in Utah in the mountains, which was absolutely gorgeous. And I was working for a really great practice, actually, seeing patients every day, every 15 minutes. And at some point in my training or at some point in my practice, I started to realize that patients were asking me a lot about holistic health. And I really had no training in that at all. And so I thought to myself, well, I better get some. So I actually went ahead and did a 2-year fellowship through University of Arizona in Tucson, which is Andrew Weil's program, if anyone
Okay.
is familiar with him. And from there, I ended up working for some other practices after I graduated. And things really came to a head in 2020 during the pandemic. And in my practice, so many kids, so many teens just needed help with anxiety, with depression, with focus issues, all kinds of brain health problems, emotional dysregulation, for example. And the limitations that were there at the company that I was working for were many because it was a more conventional practice.
Right.
And so I really needed to strike out on my own so that I could help people that have these issues in a more holistic way. And that's why Middle Path was born.
Okay. Such a great
Yeah.
backstory. So you're a DO
I,
specializing in pediatrics, which is such a just a great and interesting background.
yeah.
Um, how would you compare that to like your traditional MD route?
Mm. So a DO is generally more holistic in nature. So we get a lot of training on environment and how things physically are affecting the body, how the tissues and the muscles and the nerves are all related.
Mhm.
Um, so I think that that training has a way of maybe pushing people who are a little more holistic to join because it sort of highlights the connection between like brain, gut, body, health, all of these different
Right.
things. Um, Whereas I've noticed with my MD colleagues, I think it's a little bit more symptom based rather than system based. And we do a lot of hands on medicine as well. So In my other work, I also did some manipulative therapy on infants to help them sleep and with reflux and
Ah,
like that. So that's another modality that, as an osteopath, we have available.
okay. Really, really great stuff. Okay. All right. So you made the shift then because initially you started to get a lot of questions
Yes.
about integrative approaches. Kind of, were they based on kind of like maybe parents asking for treatment that doesn't necessarily lean into prescription medications first line?
Yeah, absolutely. I think that, people were looking for nutritional interventions or therapeutic interventions that I wasn't familiar with. So, for example, like acupuncture can be really helpful for pain, massage therapy, occupational therapy, um, and supplements, botanicals, detox protocols, homeopathy. So, a lot of different techniques that just weren't in my toolbox. And I had to go seek those out in order to be able to advise people properly on what could or could not help them. Sometimes I see people kind of getting on Facebook and they're getting a lot of answers like, oh, just take this supplement or take this, herb
Right.
and, and, it's okay. I don't know if it's going to necessarily do harm unless there's something that's going to interact with those supplements that we don't know about. But what I do notice is people are just not getting the testing that they need initially to determine what's actually necessary for their specific child. And that's something that I was able to learn by going through my training. Because prior to that, I just kind of thought, oh, well, you just go to Whole Foods and it says brain health. So I'll
Yeah,
just
you buy the supplement, right?
yeah, I'll just take that and that's going to work. And that's just not really how the body works at all. We really have to get to the bottom of
Mm.
how your specific child's physiology is, how all the chemicals are in the body, and how they're moving and shifting. And to do that, we need to do testing. And then based on that, we can decide, what nutrition is needed for your specific child, what supplements are needed for your specific child, and what environmental changes are needed in your specific family life, depending on what's going on there too.
Okay. All right. So now you're in private practice
Mhm.
and you work in specifically specializing in helping families and kiddos who have this challenge, right? And it sounds like, I mean, it's even much bigger, really, if we look at it, than ADHD, anxiety, and depression. I heard you say focus issues. So tell us a little bit about that.
Yeah. So sometimes, sometimes what I see happening is that children will have some of these issues, like they can't focus, they're a little bit hyper, they're not getting their homework done. They're stressed out. They can't stay in school all day because of anxiety or panic attacks, or they're just too sad to get up and go.
Mm.
And, people tend to go to their primary care doctor first. And that has mixed results. So, if you're looking for something other than therapy or a pharmaceutical medication, you're unlikely to find it at the primary care doctor. So that's kind of where I come in. If you're looking for something that's outside of the box and you don't want to start pharmaceutical medication like antidepressants or anti-anxiety medicine or stimulant medication for ADHD, and you want to see what is the root cause of the problem, that's where I come in. And that's where we do
Mm.
all of the testing to determine what's going on with your brain chemical, your child's brain chemicals, their gut health, which actually is related to your brain, and your organic acids, which is another way we can kind of look at
Okay.
what's going on in the body. Mhm.
Interesting. Okay, so you work with these kiddos and you work in a program model, right? So
Yeah.
can you tell us a little bit about what your brain program is all about?
Yeah. I love to work in a program because people really just get the results that they're
Mhm.
looking for. With one-off visits, we're all human, myself included. The tendency is just to kind of do a visit, maybe try one thing, 4 months
Yep.
later, try another thing, and nothing's really progressing.
Yep.
So I love to work with people who are just absolutely committed to doing a 6-month program, and then we can get the results that they're looking for, more quickly and efficiently. Um, and it's just more optimal for people in general and
Yep.
cost effective actually too. So
Yeah. Isn't
yeah,
that the truth?
yeah,
Yeah, and I love it because the thing that I've noticed is, well, so many different reasons the program model really works, but specifically, it just seems like as soon as the patient or the family or whatever, as soon as they hit a roadblock, like sometimes they fall off, right?
yeah,
And
because things can be
so it
hard.
makes it really challenging. And so for our listeners, the other really, really big thing is the patient or the client is focused on honestly the wrong thing in the a la carte model, right? Just like Ellie alluded to, they're focused a lot of times, unfortunately, they are really focused on like the cost of each session instead of the results, right? So they're like, they just kind of assess each session and they're like, oh, I don't know, was that, really worth X dollars? Maybe I can, figure this out on my own. And then the other thing I've noticed is sometimes people fall off because they're embarrassed. Like if they, if they're not progressing, they kind of, have some self-blame, or if they kind of fall off and then you don't see him again, right? Like I know this used to happen to me all the time in my nutrition practice before I implemented programs. And it was so frustrating, right? Because you want to be able to help people to achieve those amazing transformations. So I'm really, really pleased to hear that you are in the program model. Really great. So how would you say your program is, I don't know, different from others out there?
Well, for one, you get me and only me at your
Amazing.
service, and you get great access
Yep.
via email and text and phone. So I'm always available to you during office hours.
Hmm.
And you get 2 visits with me a month. We start off with a really great hour and 45-minute kickoff session.
Wow.
Yeah. So we go deep. We really do. I'm going to sit and go through your child's birth history, your environmental history. Are there any toxins that are being exposed to your child? Their nutrition? Is there anything specific for them that they're missing or that we need to do? Um, Genomics, so looking at the ancestral history is really
Hmm.
important. Interestingly, if your grandma had trauma, it could be affecting your child due to something known as epigenetics. So all of those things are important and it takes time. Even spiritual health. So I actually was talking to a client the other day who was just absolutely just devastated because they had moved and were unable to attend the church that they used to go to, and their whole community was
Uh-huh.
destroyed, and it was or gone, I guess, because
Mhm.
they had
Yeah.
moved. And, we were talking about that. And it was so funny because she said to me, well, when we get to the medicine part, or when do we get to the medicine part? I was like, this is the medicine part. This is so important.
Spirituality is part of the picture, and
Yes.
sense of community and social support, right?
Right. Right. And I don't have an agenda on
So
what,
interesting.
yeah. And there's no agenda on what anyone's particular, background, spirituality,
Sure.
and like that, but just to support that person in their value system. So
Right.
then from there, the next 5 months, you'll get 2 touch points with me. You'll get a 45-minute visit and then a 30-minute phone call. Of course, you have access to me in between for questions that can't wait. Um, you also get some bonuses. You get some free testing, which is great, depending on if your child has issues with attention deficit disorder or anxiety, depression. Those tests are a little
Mhm.
bit different, but they're both valued right around $600-700, just rolled right
Wow.
into the program. And because I have it bundled this way, I can offer that, which is another reason I think the program is so valuable. You know,
Yeah, and I love that you're working with patients over a 6-month period,
yes,
right? Like you
yes.
can really dig in and see results in that time frame.
Yeah, absolutely. And some of the changes that we need to make take time. For example, working on child's nutritional health, it's not usually within the first week that you can just, snap your fingers and now they're eating a variety of foods.
No.
We have to take that a little slower. And so it gives us the opportunity to do that without, causing, undue stress to either yourself or your child. Because I'm not here to add extra stress to your life. We're actually here to kind of remove those layers. And on that, I also give you guys 7-day meal plans, sample meal
Wow.
plans, and an educational library as part of my program as well. So really quite a lot of bonuses. Let me see what else. Oh, and I offer 15% off all of the supplements.
Oh, wow, that's huge. On full script,
Yeah,
right?
yeah, on full
Yeah,
script.
that's a really, that saves a ton of money right there.
Yeah, and they're safe as opposed to something you might be getting on Amazon that's contaminated or old or has been sitting in a warehouse for.
Oh my gosh, absolutely. There are so many issues with, oh my gosh, I would just say no to buying supplements on
Yeah,
Amazon,
yeah.
right?
I just
There's been studies done on that,
yeah, I
and
just
they're
read
so
a study.
frightening,
Yeah.
right?
There was a herbal supplement for focus. It actually just had Adderall in it. So you just don't know.
Crazy.
Yeah.
And
Mhm.
these, and not to mention, these would be supplements for children whose,
Mhm.
I would imagine their systems are much more sensitive.
Yeah.
So yeah, it's just an important reminder to just make sure you're purchasing supplements and offering supplements from a reputable source, such as Full Script.
Hmm.
So very important. So what I want to kind of shift into is a conversation around, and I've shared with you before, Ellie, that I used to hear this with my kids, right? When they were growing up, oh, it's just a phase, they'll outgrow it, or this is just how they are.
Mhm.
And my thought on that back then was, I don't know, anything that just seems too hard, just, I don't know, does not really seem like a phase to me, but it can sometimes be a little bit of a tug of war, right? With the traditional medical model. So what are your thoughts around, oh, it's just a phase,
Ooh, I have so many thoughts on this.
right? It's huge.
Yeah. Okay, so my sense is if this is something that feels above and beyond, it's overwhelming, your whole life is focused on this one issue,
Mhm.
it's disturbing your child's ability to function.
Mm.
They're unable to go to school, they're having school troubles, grades are either great because they're so anxious,
Hyper vigilant, right?
hyper vigilant, yes, or not so great because they're really struggling to pay attention. Anything that feels like that is something that needs to be addressed and is likely not a phase. For example, some kids with separation anxiety early on usually happens around 2, 3, 4 years old, somewhere in there.
Mhm.
Um, you know, are having so much anxiety that they really just can't even attend a preschool or a birthday party or anything, even
Mm.
with transition time built in. And parents will go to the pediatrician and are often told it's a phase.
Yes.
But what actually happens is the separation anxiety usually will snowball into some kind of social anxiety. And then that
Okay.
snowball, when it's extreme, into general anxiety and possibly panic attacks. So the earlier that we can intervene, the better. Okay. Especially like with ADHD, it's important to intervene early. We don't even need to put the label necessarily. I don't need the label for what I do. I don't need anything for what I do. If you're
Yeah.
telling your child's having these symptoms, we can look at it from a holistic standpoint by examining your kid's brain physiology
Hmm.
and going from there. So it's important not to wait. And to be honest, I think that sometimes, although things are changing, thank goodness, um, sometimes people are some medical doctors are a little bit nervous because they really haven't been trained on these issues.
Mm.
And I think sometimes people are afraid to say they don't know. So instead of
Yeah, I
saying,
can
I
see
don't
that.
know, yeah, the answer is it's a phase. So
Got it. Yeah,
yeah,
it's just kind of a reflexive, if I don't know, it's a phase.
yeah, because people are human and it's embarrassing to say that for some humans. I personally am not like that. If there's something I don't know, I will tell you and I
Yeah.
will find out for you. But I think things are changing, but unfortunately, not everyone's been trained in holistic health, and not everyone is as aware of what is typical and what's not typical behavior.
Mhm.
Because believe it or not, your pediatrician was not trained on that extensively, right? So same as nutrition, they weren't trained on nutrition
Right.
extensively. And it's shocking to hear that. You would think your pediatrician had extensive training on nutrition, breastfeeding, development. No, no, no.
You would think,
Yeah.
right? Oh my
You
gosh.
Yeah, no, but the classic training focuses on what is some, horrible disease that we need to treat and how to treat it. So if you have a child who has, appendicitis and they're having severe abdominal pain, they need a heroic measure. That's an appropriate time to see a
Yes.
medical doctor.
Yes, for sure.
Yes. If you're having a child with chronic ongoing issues that aren't being addressed by the conventional medical community, that's probably the time to step out and look at what the other options are,
Okay.
unless you're really wanting a pharmaceutical medication.
Oh, that's such a good point because I was going to ask you next, like, how do we know at what point do we, as a parent, or even for our listeners, whether, you're pondering this for your own child, or, maybe you've got even a parent and they tell you about their child who's like, how do you know when it's time?
Yeah. Well, one, going back to that sensation of it being too hard, too overwhelming.
Yep.
So feeling that, um, seek something different, seek some care somewhere.
Yep.
And the second one is if you know there's an issue in your heart, in your intuition, in your maternal instinct,
Yeah.
there usually is,
So
and
listen to your instincts.
yeah, don't blow that off. Definitely listen to that. And the third reason is if you have been to your provider, your primary care provider, whether it's a family doctor or pediatrician, and you're not getting any answers or you're not getting anywhere, or you feel like you're being blown off or you're beating your head against a brick wall trying to get help, it's probably because you need to go somewhere else for this
Mhm.
specific issue.
Mhm.
Yeah. I mean,
Okay.
if you like your primary care for other things, by all means, keep them. But if you're
Right.
feeling like, for
Because
the
someone like yourself, you're not doing primary care.
correct.
You're a
Yeah.
specialist in this area.
Yes. That's
So it almost seems like you probably do want to hang on to your primary care for like all the other stuff, right?
yeah. When you need to get a lung exam because your kiddo has a cough or they've got
Right.
pink eye or something like that, by all means, stay with them because I am 100% virtual and telehealth. So I'm
Yeah.
able to do a physical exam, first of all. And second of all, I'm a specialist in integrative and functional medicine. And I'm not practicing primary care right now.
Okay. So what would you say, Ellie, what are the biggest mistakes that you're
Mm,
seeing parents make? And these are, I'm sure, very well intended,
mhm.
probably mistakes, right? That, probably we're not even really aware we're making, right? So
Yeah.
what would you say?
I mean, the number one is just trying to go it alone.
Yeah.
You know, um, I think sometimes, myself included, you
Yeah.
just kind of think, oh, I can take care of it. I'll just like look some things up online, whatever it may be, Um, I'll give you an example from my own life, like QuickBooks. I was like, for sure, I've got it figured out.
Yeah.
And I didn't know what I was doing. I had to go get a bookkeeper and accountant. So, find
Right.
expertise when you need it.
Do what you're good at, right? And the
Yeah.
stuff that, you're not. Yeah. I think going it alone in this kind of situation really can, yeah, probably not going to get the results you want.
Yeah, no,
right?
and it's such a struggle. It's so emotionally exhausting. Um, I've been on a few Facebook groups trying to answer questions just to help people.
Yeah.
And I noticed that a lot of people kind of have the same questions. What supplement do I take for X, Y, and Z? And my answer is always the same. Is like, I can't tell you. I
Because I
don't
don't
know.
know what the root problem is.
This is what I recommend. I recommend that you seek out a functional medicine integrated provider locally or with me, depending, because I'm licensed in North Carolina and California.
Yeah.
So, if you're in one of those states, by all means, please reach out. If not, find someone local
Yeah.
that can do the testing so that you're not buying, thousands of dollars of supplements that don't work, aren't right for your child. You're in Whole Foods buying brands that you have no idea if they've been tested or effective, or
Right.
nothing against Whole Foods, just saying like,
Yeah. I
you
mean,
know,
any Costco for that matter, right?
yeah,
Like,
Costco, CVS, any of these. And now you've bought thousands of dollars of supplements, so you don't know if they're working. You're kind of just throwing spaghetti at the wall, hoping something will stick.
yeah.
Um, so I think that's the biggest thing really, is just going it alone and just kind of trying to guess what your kid's physiology is needing. Or
Yeah.
on the other hand, they might not be deficient. They might actually have something that's driving the problem,
Oh,
which is another aspect that people don't often consider. So like, for example, kids with ADHD that are very young or just unfocused, or
mhm.
can't stay in preschool, that kind of thing. It could be that they have either a gut infection like yeast or Clostridia that's driving the problem, or it could be very commonly a food allergy that's
Okay.
driving the issue. So
Oh,
especially in
that's
young children.
interesting.
Yeah.
So do you do in your work, so you look at the gut health. Can you kind of give us like a sense of the steps that maybe you would take a patient through?
Yeah, 100%. So it does depend a little on age and
Okay.
also on what the symptoms are. So just kind of keep it in mind, it'll be
Sure.
personalized
Yeah,
for
it's
them.
got to be personalized, right? Based
Yeah.
on age and symptoms. Okay,
Yeah.
got it.
Yeah. But older teens for anxiety and depression, I'm talking about 16 and up,
Okay.
usually I'll start with an adrenal test, and that looks
Hmm,
at our stress hormone levels. Mhm. So oftentimes
interesting.
teens are very stressed out. They're trying to apply to college, they're not getting much sleep, they're in
Right.
sports, and no wonder they're anxious and not feeling well. And so it's important to start with that kind of testing. Generally, from there, after we've corrected any issues that we may find with their cortisol, I'll move into gut testing. And that way we can rule out any infections that might be driving the problem. Sometimes that's plenty. That's all we need to do. If not, we can move into looking at the hormones in the brain, the catecholamines, which are neurotransmitters, another fancy way to say hormones in the brain that help with mood.
Okay.
So some of you may be familiar with serotonin or epinephrine, dopamine, all of these things. So we can look at that as well. And so through that, I can determine, what supplements will be helpful, what herbs will be helpful. And then layered on that is all of the lifestyle that we need to do. Okay. And then
Okay.
with ADHD, it's a little different. Depending on the age of the child, I'll do food allergy testing. I don't usually do it in the older kids unless there's a specific issue pointing to that.
Okay.
But the younger children for sure need it. And then we can look at nutritional imbalances that's based on a hair test that I like to do.
Oh, okay.
Mm-hmm. Organic acids again, looking at the brain chemicals, and then gut health, because oftentimes you can see infections that are driving like lack of focus. So those
Interesting.
are the main testing pillars.
Okay.
And then surrounding that, or the container of that, is all of the you know what else is going on. Like, do you live near a radio tower that's got ionizing radiation? Are
Yeah.
you is your water safe? Does God forbid, do you have uranium in your water or something that's
Okay.
un not super healthy for humans. It might be, FDA approved, or, whoever the governing board is, but it might not be the most optimal for
Right.
your health, right? Is there mold? Is there noise from news feed that we're watching 24/7? Are we on TikTok 24/7? So
Yes.
the input that we're getting from different areas of our life, and how can we strip away what's not helpful, and how can we layer on what is helpful so that we can work towards well-being. Mm-hmm. And it's a
Okay.
family process, Leslie. We can't do it just, it's just not possible to say, okay, for this child, we're going to do it this way, but everyone else in the family is going to do something different. That's usually not really effective. So we need to talk about that a lot, because obviously, what parents are doing affects what children are doing,
Oh
because
yeah.
have to be
It
best.
is. It
Yeah.
really and the parents are the ones, making the decisions. It's not like a 5-year-old can, make
Yeah.
decisions for themselves around these things.
Yeah.
Um, yeah, were you going to say something?
Oh, I was just thinking about for myself, so I have celiac disorder, which is a severe allergy to gluten. And when I was first diagnosed, I thought, well, oh, my husband can just keep eating gluten in the house and that will be fine.
Yeah,
And I realized very quickly that's not going to work at all, because everything in the home is contaminated. So, with the best of intention, we can be creating an environment that's not as healthy as we'd like for our child and
right.
our spouse in this case. But
Yeah, exactly. Yeah,
hmm,
you mean really well, but yeah, sometimes it just doesn't work out.
yeah,
So, all right. So as we start to wrap up, do you have any final words of wisdom that you'd like to share? Any,
I yeah, I would say if you think there's an issue, there probably is,
okay.
and don't go it alone.
Okay. I love that.
Yeah.
And how can people find you to learn more?
So my website is Middle Path Integrative
Okay.
Pediatrics.com. And I do have a brain health guide. It's an ebook. There's no fluff. You would think
Okay.
that you would be worried about getting. It's actually really extensive. I haven't checked recently, but I think it's around 20 pages. And it gives you some really good first tips on how to start treating your child's brain health through nutrition and through the gut.
Okay.
And it's all over
Awesome.
the
So
website.
oh, I'm sorry, is the URL Middle Path Integrative Pediatrics.com/ brain dash health dash guide.
That's right.
And we'll be sure to add that URL in the comments just so you all can grab it. And honestly, based on everything I know, I would just, if our practitioners out there want to learn more, definitely reach out, grab that guide, drop Dr. Ellie an email. And especially if you have kiddos that are struggling and you are looking for a more holistic approach, you don't want to just go to medications as first line therapy, reach out, definitely reach out, at least have a consultation with, especially if you're in Dr. Ellie's states, right? Which is North Carolina or California.
Correct.
Reach out and yeah, and just see if, working with her is actually a good fit. All right. Well, time flew, no surprise. This is such a great topic. I do want to thank you for sharing all these great pearls of wisdom. And I'll look forward to seeing you all next week, same time, same place. All right. Bye, everybody. Okay.